Chapter 12, Arousal Regulation. Why regulate arousal? Athletes need to be able to regulate arousal to stay focused and in control. You must increase your awareness of your psychological state before you can control your thoughts and feelings. Once you are aware of your optimal arousal, you can employ arousal regulation, which includes reduction, maintenance, or induction strategies. People who do not effectively cope with stress may experience decrease in performance, as well as mental and physical distress. How someone copes with anxiety is more important than how much anxiety they have. Our goal is to learn to regulate arousal, to stay focused and in control. We must increase our awareness of our psychological states before we can control our thoughts and feelings. Athletes should be encouraged to learn a broad spectrum of coping strategies to be able to use in different situations and for different forms of stress. Lazarus and Folkman define coping as a process of constantly changing cognitive and behavioral efforts to manage specific external and/or internal demands or conflicts, appraised as talking or exceeding one's resources. As we begin talking about performance, we need to go back to the inverted U hypothesis. Just as a refresher, the inverted U hypothesis suggests that above a certain level of arousal, your performance will decrease. An extreme level of arousal can lead to a lack of awareness and attention outside oneself. According to the theory, performance will improve as arousal increases until it reaches a point where optimum performance is achieved. And arousal is at its optimum level. If arousal increases beyond this point, performance will begin to deteriorate. This will be important to keep in mind as we discuss arousal regulation. We would like to keep our athletes in the green area as much as possible to increase the effectiveness of their performance. This is also a review. Sports psychologists have noted that performance does not always gradually decrease as arousal increases, as shown in the inverted U theory. This is evident as many top sports people go to pieces in the big event. The catastrophic theory shows a much more dramatic decline in performance. Physiological arousal is related to performance in the inverted U fashion when the athlete is not worried or has low cognitive anxiety state anxiety. If cognitive anxiety is high, the increase in arousal passes a point of optimal arousal and a rapid decline in performance occurs. This is known as a catastrophe. It would be very difficult to recover from this point. The theory takes into account that anxiety, or a negative reaction of a performer to stress, can be of two types, either somatic anxiety, which is physiological, such as sweating, or cognitive anxiety, which is psychological. Such examples would be worrying about failing. The catastrophic theory concludes that increases in levels of cognitive anxiety will help performance if somatic anxiety is low. So if the body is relaxed but the performer is feeling anxious, then this anxiety can help to improve performance. If there is an increase in cognitive anxiety and somatic anxiety is high, then performance will decline. If there are high levels of cognitive anxiety and there are also continuous increases in somatic anxiety or physiological arousal, then performance can suddenly deteriorate, which is a catastrophic response. If, after this catastrophic effect, arousal decreases, then performance will once again improve, but not back to its original optimal level. Anxiety is a part of life. So how can we get our control back and manage our lives and performances? We can increase awareness of our psychological state. Once we are aware, we can learn to regulate it. Coping with anxiety is more important than how much anxiety you experience. Reducing somatic anxiety. Somatic anxiety is the physical symptoms of anxiety, such as butterflies in the stomach. It is commonly contrasted with cognitive anxiety, which is the mental manifestation of anxiety, or the specific thought process that occurs during anxiety, such as concern or worry. Progressive relaxation is a technique that can be utilized to assist with somatic anxiety symptoms. This technique involves tensing and relaxing specific muscles. The tensing and relaxing progresses from one major muscle group to the next until all muscle groups are completely relaxed. Progressive relaxation is a true somatic technique. It is easy to learn. The basic principle is to learn to feel the tension in your muscles. Then let go of all of the tension and let the muscle become heavy. We can also learn to control our breathing in stressful situations. Anxiety can affect our breathing. Proper breathing is often considered key to achieving relaxation. Breath control is another somatic-oriented relaxation technique. Breathing control is an easy, effective way to control anxiety and muscle tension. When we're calm, our breathing is likely to be smooth, deep, and rhythmic. When we're stressed or under pressure and are tense, our breathing is more likely to be short, shallow, and irregular. The next time you have a big test coming up, see how deep your breathing is. Can you take a deep breath? If you're super stressed, you may not be able to. Biofeedback is a physiological-oriented technique teaching people to control their physiological or autonomic response. This typically involves an electronic monitoring device. This detects and amplifies internal responses we usually aren't even aware of, such as muscle activity, skin temperature, brain waves, or heart rate. The majority of relaxation techniques focuses on efferent nerve control. This includes the stimulation from the brain to the muscles. The techniques for dealing with cognitive anxiety focus more directly on relaxing the mind than do the progressive relaxation and deep breathing. Both techniques result in a relaxed state, however, they work through different pathways. The cognitive relaxation response occurs when we teach the individual how to quiet the mind, concentrate, and reduce muscle tension. Most of these techniques apply to the basic elements of meditation. Meditation teaches you to quiet the mind, concentrate, and reduce muscle tension. The practice of meditation involves the practice of mindfulness or teaching centering. Regular meditation practice helps teach a deep state of relaxation. It also facilitates concentration by disciplining the mind. The relaxation response teaches you to quiet the mind, which will help you to concentrate and reduce muscle tension. Learning the relaxation response takes time. You should practice it about 20 minutes a day. It can be extremely difficult to control your mind and focus on one thought or object. So what does meditation and the relaxation response require? It requires a quiet environment, a comfortable position. You may have to employ a mental device to help you quiet the mind. Some people use a blank chalkboard, and the goal is to keep it blank. For example, you have no outside thought. Any thought shows up as a writing on the chalkboard, and you quickly erase it. And it helps to have a passive attitude. You cannot get disappointed if you get distracted. Rather, refocus and try again. In the living brain, millions of nerve cells communicate with each other by emitting tiny electrical impulses. This activity can be registered as oscillations, popularly called brainwaves, by placing electrodes on the scalp, amplifying the signals, and displaying them on a computer monitor. This method of measuring is called electroencephalography, or EEG for short. Brainwave activity tends to fall into 4 groups: beta, alpha, theta, and delta. These categories are associated with the rapid oscillation or frequency of brainwaves. As it turns out, certain patterns of brainwave activity are associated with specific mental states. The 4 types of brainwaves in more detail. Beta waves are approximately 15 to 30 oscillations or waves per second, or hertz. This is the brain rhythm in normal wakeful state associated with thinking, conscious problem solving, and active attention directed towards the outer world. You are most likely in the beta state while you're listening and reading your lecture notes. Alpha waves are between 19 and 14 hertz. When you are truly relaxed, your brain activity slows from rapid patterns of beta into more gentle waves of alpha. Fresh creative energy begins to flow. Fears vanish, and you'll experience a liberating sense of peace and well-being. The alpha state is where meditation starts and you begin to access the wealth of creativity that lies just below our conscious awareness. It is the gateway that leads to deeper states of consciousness. Theta waves occur between 4 and 8 Hertz. Going deeper into the relaxation and meditation, you enter the theta state, where brain activity slows almost to the point of sleep. Theta brings forward heightened receptivity, flashes of dreamlike imagery, inspiration, and sometimes your long-forgotten memories. It can also give you a sensation of floating. Theta is one of the more elusive and extraordinary realms that we can explore. It is also known as the twilight state, which we normally only experience fleetingly as we rise out of the depths of delta upon waking or upon drifting off to sleep. In theta, we are in a waking dream. We are receptive to information beyond our normal conscious awareness. Some people believe that theta meditation awakens intuition and other extrasensory perception skills. Finally, delta waves are between 1 and 3 Hertz. These are the slowest of the brainwave activity and are found during sleep, especially dreamless sleep. It is also sometimes found in very experienced meditators. During unconscious states such as deep sleep, the slow delta waves are dominant, whereas it is the high-frequency beta waves that are prevalent during conscious and wakeful activity. The vagus nerve has sometimes become known as the meditation highway. What is the vagus nerve? It's the longest nerve in your body. The name roughly translates as wandering nerve. The vagus nerve travels from your brainstem, winding down through your body to finish in your abdomen. On the way, it connects with many major organs, including the heart and lungs. The vagus nerve is semi-responsible for your body's regulation of heart rate, breathing rate, digestion, and so forth. The mind has a great influence over the body, and maladies often have their origin here. Molière said this. Your immune system is controlled by a nerve called the vagus nerve. But this isn't just any nerve. It is the most important nerve coming from the brain and traveling to all the major organs. We can activate this nerve through relaxation, meditation, and other ancient practices. By activating the vagus nerve, we can control our immune cells, reduce inflammation, and even prevent diseases and aging. By creating positive brain states, as meditation masters have done for centuries, you can switch on the vagus nerve and can control inflammation. The known possible benefits of meditation include relaxation, a sense of balance, reduction in anxiety, anger, and pain, increases in energy, helping with heart disease, helping us control our thoughts, and reduction of stress. These benefits are largely due to the vagus nerve's ability to influence the parasympathetic nervous system. Autogenic training. Autogenic training is a series of warmth and heaviness. This was initially used mostly by European athletes. However, it is now much more popular in the United States. Attention is focused on the sensations that you are trying to produce. As the relaxation response, filling should be allowed to happen without interference. There's a series of exercises designed to produce two physical sensations, warmth and heaviness. Both sensations can lead to relaxation. This is a form of auto or self-hypnosis. In order for autogenic training to work, we need to place attention on the sensations to be produced. The autogenic training program is based on 6 hierarchical stages, which should be learned in order. First, heaviness in the extremities. Second, warmth in the extremities. Third, regulation of cardiac activity. Fourth, regulation of breathing. Fifth, abdominal warmth. And finally, sixth, cooling of the forehead. This generally takes several months of regular practice, 10 to 40 minutes a day, to become proficient. Multimodal stress management packages work to alleviate both cognitive and somatic anxiety and provides systematic strategies to develop coping procedures for stressful situations. A key feature of these techniques is that they help athletes develop a number of coping skills for managing a wide variety of problems resulting from stressful situations. Cognitive Effective Stress Management Training, or SMT. Cognitive Effective Stress Management Training. SMT teaches a person to specifically integrate coping responses. It uses relaxation and cognitive components to control arousal. You are exposed to and learn to cope with stress in increasing amounts. And this is accomplished through productive thoughts, mental images, and self-statements. This results in enhanced stress immunity. Other techniques include: hypnosis is defined as an altered state of consciousness that can be induced by a procedure in which a person is in an unusually relaxed state and responds to suggestions for making alterations in perceptions, feelings, thoughts, or actions. Stress inoculation training. The individual is exposed to and learns to cope with stress in increasing amounts, thereby enhancing their immunity to stress. Stress inoculation training, or SIT, teaches skills for coping with psychological stressors and for enhancing performance. The matching hypothesis theory. This hypothesis states that an anxiety management technique should be matched to a particular anxiety problem. We should treat cognitive anxiety with mental relaxation, and somatic anxiety should be treated with physical relaxation. If you aren't sure exactly which type of anxiety is occurring, we can use the multimodal technique. Coping is a dynamic process involving the cognitive and behavioral efforts to manage stress. This is an effort to alter or manage the problem that is causing the stress. For example, practicing time management or problem-solving skills training. Problem-focused coping can be used when stressful situations can be altered. Emotion-focused coping. This focuses on regulating the emotional response to the problem that caused the stress. For example, relaxation or meditation strategies. Emotion-focused coping should be used when situations are not likely to change.